Hey, everybody, and welcome back to another edition of the Migraine Mentors minicast. We are your hosts, the Migraine Mentors, and we're excited to talk with you today. I'm Dr. Erik Reis. I'm one of the Migraine Mentors, and I'm here with my esteemed colleague, Dr. Thompson Maesaka. Thompson, say a little something into the camera.
What's up, listeners? So happy you're here to join us today. We have a topic that actually one of our subscribers asked us to talk about because it was near and dear to her heart. So we're loving the feedback we're getting from you guys. We're loving that you're listening and helping us make this better for you. So we're excited to dive into the topic today, Erik. What are we discussing?
We are discussing everyone's favorite weekday topic, iron deficiency anemia. And not just iron deficiency anemia, but we're going to kind of highlight the importance of iron in our diet. For those of you who are unfamiliar with this topic, I think this is going to be a really educational piece for you. I know we both have learned things about this, just even studying this and having the conversation that we did with our subscriber who's in Germany. So thank you so much for the feedback. Dr. Maesaka, I want to kind of just start with you. So, for those who don't really understand why we need iron or what iron is important for, can you just kind of maybe give a general ballpark overview of why we need iron in our lives and why it helps us?
Yeah. It is essentially a very important aspect of what helps bring blood to tissues. So iron carries hemoglobin, and hemoglobin binds oxygen, basically. So if you don't have enough iron, you're not going to have enough oxygen. Or if you don't have enough oxygen, any instability you have in your nervous system is going to be more unstable, essentially. It really comes down to brain cells need three things: oxygen, fuel, and activation. And if it doesn't have one of those things or several of those things, the others are going to have to kind of make up for it. So if you have some sort of anemia, specifically a lack of iron due to a number of factors Dr. Reis will talk about, it's going to make any instability you have more prevalent, which is basically just big words for you're going to have more migraines.
Perfect. And I think when we think about iron, I think people immediately think of like spinach. They think of like Popeye. I know I kind of do with like muscles and flexing and all that. And yeah, it's important for that. As Dr. Maesaka said, iron is an important factor for like red blood cells and hemoglobin and making sure that it can bind oxygen to the red blood cell, carry it to tissues. So you can live days, weeks, months without food. You can only live, minutes, or even like seconds without oxygen. And so this is a really important aspect, especially for patients who struggle with migraine. Why iron is so important for us from a, cellular health standpoint is that iron is implicated for red blood cells and the production of hemoglobin and the utilization of oxygen for that. Iron is also really important for mitochondrial function. So we've talked about this ad nauseum in the past with previous episodes, but your mitochondria really are like the powerhouses of the cell that produce the energy currency, we'll call it, which is ATP. And so your mitochondria are just heavily reliant on iron. The other interesting fact that we found out that we were talking about is that iron is actually a really important factor for the production of specific neurotransmitters. One of them is serotonin. And as we've discussed in the past, and if you're aware, or if you're taking a medication like an SSRI or an SNRI, serotonin is something that's really important for managing migraine symptoms and then also just general brain function. What I also found interesting, and this is something that I would love to hear from Dr. Maesaka as well, is that iron can actually, when you're deficient in iron, those iron levels affect the stability or the threshold of different neurons. And we've talked about this in the past. I'm going to let Dr. Maesaka take it over. That instability of those neurons is really important for that process in migraine called cortical spreading depression. Dr. Maesaka, do you want to kind of explain a bit about that? You have a great analogy as well, too, for what CSD does in the brain. I think that would really help everybody kind of get on the same page for that.
Yeah, I love talking about this with patients because when they fix it, they immediately have less migraine. So the easiest way to think about it is a healthy nerve cell, one that is not prone to spontaneous discharging, which is kind of a characteristic of migraine, is it has a really big difference in charge from outside to in. So you need a big, hefty punch for that neuron to fire off and do its thing. And that's why we've talked about it ad nauseum in the past about supplementing electrolytes. So that's one easy way to make sure that the difference in charge between outside and inside is really big. So that is one aspect as to what makes neurons stable. The other aspect that we're talking about today is making sure that they have enough oxygen. So if you have a cell that is not consistently getting oxygen, it is going to become really easy to activate, which is then in turn going to lead to a higher likelihood you'll get a migraine. So when it comes to cortical spreading depression, the new way of looking at it, especially when you're diagnosing migraine, is once the cortical spreading depression happens, which again kind of looks like a really gentle forest fire that burns from the very back, which is where you process vision. That's why some people get auras, and slowly moves throughout the entire system. And any area in that process that has a really low difference between outside to in, or what we would call a low membrane potential, is going to get affected, and essentially it fails, and whatever fails, you get symptoms. So people whose, let's say, vestibular system, balance system, has a very low membrane potential, potentially because of lack of oxygen from anemia, that area, when the cortical spreading depression happens, is likely to fail and give you dizziness, which will then in turn probably be diagnosed as vestibular migraine. It's a bit more nuanced than that, but essentially that's how we look at migraine. So the symptoms that you get during the attack tell us where we need to go and increase the membrane potential in order to make it more stable, so that when the attack happens, you don't get those crazy symptoms. The analogy I use is, if you remember, during COVID, a bunch of businesses closed down. So essentially those businesses had a very low membrane potential. They didn't have a lot of room to sort of wiggle financially. So COVID comes, shuts down all the businesses. The ones that were really healthy survived. The small businesses that didn't have a lot of cash did not survive. So the small businesses in the migraine context are the areas that don't have enough oxygen, they don't have enough activation, they don't have enough fuel, and those are typically the ones that fail and give you symptoms during an attack. So in the context of anemia, really important to make sure those areas have enough blood, because it's one of those three things that make things more stable.
Yeah, great. That's well stated. Far better than what I could probably describe, to be fair. So grateful to have you on this. One of the things that is interesting for this as well, that we found with our research, was, well, why is this so important for migraine? Well, traditionally speaking, migraine affects women 4 times more likely than it does men. And so with that being said, inherently what happens is you have to look at, what do females deal with more often than men? Well, menstrual cycles, right? So having a period. And so why this is relevant, and why women are more prone for iron deficiency anemia, and why we'll actually generally never ever supplement iron with a man, is because men don't menstruate or have excessive blood loss on a regular basis. And what can happen is that if you have too much iron in your system, you can actually have a condition called hemochromatosis, which I was tested for and thought I had years ago, which thank God I don't. But for women, when you're losing blood consistently and having these menstrual cycles, you are more prone to being iron deficient because of that. So it's more relevant and prevalent in females, unfortunately. And of course, with the migraine connection there, and estrogen and progesterone and some of these hormones that are heavily implicated with this sort of system, you kind of have to be a little bit more aware. So the question is, what do you do about it? Well, you should talk to your medical doctor or your primary care physician. You should be asking them to run some standard blood tests. And more importantly, too, you should just be consistently taking inventory to see, are you getting dizziness, lightheadedness, fatigue? Are these symptoms that are around when you don't have migraines? And essentially ask those questions to get the answers that you're looking for. So hopefully that gives you a bit of background and a bit of information as to how to make a decision.
Yeah, I would say migraine fits into that bucket of things that doesn't necessarily always show up in the medical model. So I would be highly encouraging of, if the labs come back normal, take them to someone with more sensitive reference ranges. That's a lesson I recently learned in my own blood work. Is I saw everything was good and I assumed I was healthy, and then I saw them in a different context of references, and that really helped me understand that the medical system, especially with migraine, tends to grade you on a pass-fail basis, and if you fail, you are severely anemic and some other disease process is probably already manifested. That being said, you can assess blood work in a way that gives you a more sensitive and more of an A through F scale. So you can actually see where you stand in the whole kind of spectrum of anemia. A lot of times that gives you the freedom and knowledge and data to make more informed decisions, and not just say, oh crap, I'm actually anemic now, to the point when something is actually wrong. So just challenge your health professionals, because they work for you. And if you feel like you need additional blood work and they won't run it for you, there's tons of people that will.
Yeah, well stated. Yeah, I think it's important to just understand that you are in the driver's seat as a patient. You get to hire and fire your doctors, believe it or not. And the best part about that is you just need to make sure that you understand and are educated. And that's why we're doing what we're doing. Thank you for joining us again for another edition. If you're a subscriber to the Migraine Mentors newsletter, thank you for supporting us. As you saw, feedback from our subscribers is massively important for us, and we take it and we own it, and we want to make sure that we're giving the value for the people who are following us. So if you're a subscriber for the newsletter, thank you so much for joining us. If you haven't subscribed to our newsletter yet, what are you waiting for? There's a link below in this description on the YouTube channel that we have, and we'd love to have you join us. We're giving this every single week, giving tips, tricks, understanding information, clinical gems that we're using with our patients to actively help them overcome their migraine symptoms. So thanks again for joining us, and we will see you again at next week's podcast.